Hello, my name is Manuela Paulina, and I'm gonna explain about a case study of an accidental ankle twist, a kinematic analysis using functional data analysis. Football requires strength and agility to make quick movements and changes in direction to gain an advantage. Consequently, it is a sport with an elevated risk of non-contact injuries. A follow-up on the UEFA Champions League injury study showed that joint injuries to the knee and ankle were among the main contributors to injury burden in teams. A study of the Icelandic two male divisions during one season indicated that teams with fewer injury days had a better chance of success and higher league ranking. Injuries that cause high hardship on the players are ligament sprains. Also, for the English Premier League, Wolverhampton Wanderers showed that over a four-season period, 58% of foot and ankle injuries were caused by non-contact mechanisms. Of all of the factors that could cause an injury, a clear risk is the traction between the shoe and the playing surface. I'm going to describe the case study of an accidental ankle twist that happened in the biomechanics lab at Sheffield Hallam University. The case described is part of a larger single participant design study evaluating the effects of shoe traction on artificial turf. This all occurred when a dual male participant was in the lab wearing some Decathlon Kipsta Fairground shoes with 6 cylindrical studs that 3D printed on PLA. He was using a on-shoe marker set consisting of 14 markers, and he was performing different movements on a synthetic grass carpet filled with sand and rubber crumb provided by Sport. We had around a motion analysis motion capture consisting of 6 cameras. During the main study, the subject was instructed to perform a cycled on turn movement depending on a set of lights that was collocated in front of him. The subject approached the platform, and one of the lines instructed at random what kind of movement he had to perform, if it is a cycle or a turn. At the 11th trial, after 5 turns and 5 cycles randomly distributed, the subject was attempting to do a cycle and accidentally he twisted his ankle. Fortunately, he didn't fall or suffer any pain, swelling, or another indication of injury. After some minutes of rest, the subject decided to continue the test, and we captured a total of 25 trials of cycles. The analysis consisted on extracting the stance phase of the cycle trials, 24 control and 1 ankle twist, using angles and angular velocities. Trials were processed in open source functional principal component analysis or FPCA code in MATLAB. Each of the kinematic curves were represented using B-spline functions, and the first 3 functional principal components were extracted. For visualization, as you can see in one of the figures, each FPC was added or subtracted from the average angle velocity curves using our plus or minus lines to demonstrate variation in patterns due to the effects of adding or subtracting the FPC to the average curve. Each curve was given a FPC score relative to each FPC and used to evaluate how the ankle twist deviated from the control trials. A set score for the ankle twist trial was calculated relative to the mean and standard deviation of the control trials using the shown equation. Scores with values of above 1.96 or below minus 1.96 were highlighted as potentially deviating from normal cycle behavior, as suggested in previous athlete monitoring schemes. In this study, ankle angles and velocities show how the ankle twist trial differs from the other 24 cycles recorded. The ankle twist trial showed an atypical increase in inversion and internal rotation. Peak inversion and internal rotation were reached around 70 to 80% of stance. For both inversion and internal rotation angles and velocities, a two-step increase can be observed. Increased inversion and internal rotation velocities can also be observed. And there was a considerable increase in dorsiflexion velocity in the second half of the stance phase. Both increases in dorsiflexion angle and velocity are faster than in the control trials. The kinematics set scores of the ankle twist trial highlighted differences in both ankle angles and angular velocities for the different principal components of the different axes of the ankle. Regarding ankle angles, we can see that principal component 1 of plantar flexion, the minus curve, describes the switch to dorsiflexion in the ankle twist trial. For inversion, principal component number 2 shows the increase at the beginning of the stance, and principal component number 1 shows the increase in the second half of the stance. Principal component 1 and 2 of internal rotation describe similar to increases around the first and the second half of a stance. For the ankle angular velocities, principal component 1 of plantar flexion depicts mainly the sudden increase in velocity towards the end of the cycle. Principal component 1 of inversion describes the two-step increase in inversion velocity. This is also the case of principal component 2 of internal rotation velocity. This study also shows the strengths of an analytical approach using FPCA to assess changes in ankle kinematics as previously done in athlete monitoring programs. Ankle angles showed a marked increase in inversion and internal rotation in accordance to real ankle injuries occurring in the lab. But the only difference is that in this case there was a complete switch to dorsiflexion. This case suggests that the sudden increase in dorsiflexion angle and velocity might have acted as an unloading mechanism, reducing discomfort and preventing the participant from suffering a ligament injury. The largest z-score was observed for principal component number 1 of inversion velocity, indicating that inversion velocity is indeed the most distinctive pattern. This velocity showed a peak above 300 degrees per second, which has previously suggested as a threshold to prevent lateral sprains. Findings agreed that inversion velocity is reduced in normal cycle trials. Therefore, an unusual increase can differentiate between normal and injury risk trials. Z-scores highlighted which principal components within the variables describe the statistically significant differences between the ankle twist trial and the control trials. A major advantage of principal component analysis in this exploratory context over other conventional discrete point approaches is the ability for principal components to identify changes in variables at different parts of the movement. Principal components of the ankle angles describe the switch from plantar flexion to dorsiflexion and the two-step increase in inversion and external rotation. FPCA reinforces that sudden change in dorsiflexion during the ankle twist likely prevented an injury to occur. As differences in kinematics were observed in all three axes of motion, it is recommended that future research uses coordination analysis methods, such as vector coding or bivariate functional principal component analysis, to ascertain if indeed dorsiflexion can help to prevent injuries in sudden changes of direction. In conclusion, as the ankle twist trials show variability in all ankle angles and velocities, the z-scores help to identify specifically how the ankle twist trial deviated from the control trials, mainly in inversion velocity and plantar dorsiflexion, using statistically confidence intervals. It will appear from this study, as with others, that ankle inversion velocity is the main mechanism of unsafe ankle biomechanical behavior, whereas dorsiflexion is likely to appear as an unloading mechanism. Functional data analysis serves as a useful analytical method for understanding how sports injuries using a novel, exploratory, and unconventional datasets, aiding athletes and coaches to identify high-risk scenarios in the daily training environment. Functional principal component analysis can help to identify potential mechanisms behind injury during sudden changes of direction in real sports environments, aiding coaches and sports scientists to determine if changes in movement technique can increase the risk of injuries. As mentioned at the beginning, this case was part of a greater single subject study and a greater group study that studies football relevant movements like in-step kick, turn, and the side cut, and we test artificial surface traction effects on ankle kinetics and kinematics. For that, we use a systematic test of traction using 3D printed studs. The goal of these studies is to improve footwear design and create safer conditions for football players. I would like to thank you for your attention and to thank also the ISBS Student Research Grant for funding this research and Labo Sport for providing the surface for this test. Thank you very much.